On the 9th of March, prominent healthcare experts will join forces at the 20 Lessons from 2020 DigiConf, organised by ICU Management and Practice, to discuss what last year taught us from a critical care perspective. Moderated by Professor Jean-Louis Vincent, with the participation of Yasser Arab, Audrey De Jong, Vitaly Harasovich, Samir Javert, Ashish Khanna and Andre Michelson, the discussion will focus on personal experiences, lessons learned and the possible areas of improvement. Click the link in the description to register and secure one of the limited places and join the webinar on the 9th of March, 4 p.m. CET. The FDA has approved the single-shot Johnson & Johnson coronavirus vaccine. This is the third vaccine to be authorized in the US and could be a cost-effective alternative to the Pfizer and Moderna vaccines. Trials found it was 66% effective overall in severe to moderate cases. The first doses should be available soon, and the UK, EU and Canada have also ordered doses. New evidence shows that the immunisation of people 70 years and older was associated with a significant decline in the need for mechanical ventilation. Patients 70 and older were 67% less likely to require mechanical ventilation for COVID-19 in February 2021 compared with October to December 2020. These findings offer a real-world look at vaccination effectiveness and the positive impact it could have on COVID-19 associated morbidity and mortality. Researchers at Massachusetts General Hospital have developed two novel calculators that can predict which patients admitted to the hospital with COVID-19 are at the highest risk of requiring mechanical ventilation or of in-hospital death. They have developed two separate risk stratification models known as the VICE, Ventilation in COVID Estimate, and DICE, Death in COVID Estimate scores. A task force created by the Critical Care Societies Collaborative has outlined a roadmap to address burnout among critical care professionals. They recommend the role critical care societies can play in tackling this issue by promoting practices, policies and norms that promote the well-being of critical care health workers. While several steps have been suggested to address burnout, the first and most important step is that leadership must acknowledge the burden of burnout and work towards creating a culture that supports the well-being of clinicians. Read in the new issue of ICU Management and Practice. Jean-Louis Vincent and Nicole Juchemans talk about lessons from 2020 with a focus on the ICU perspective. Vitaly Harasovich, Jeremy Klein and Brian Pickering provide an overview of the large-scale transition to telemedicine during the COVID-19 pandemic. Audrey De Jong, Yasser Arab and Samir Javert evaluate whether video laryngoscopy is the new gold standard for intubation following the COVID-19 crisis. Lucas Martin, Anna Peiner, Gernot Marx and Johannes Bickenbach highlight the use and challenges of digitalization and artificial intelligence and how the focus should be on providing less rather than more data. Find these and more exclusive stories in 20 Lessons from 2020. Download now.